Joining me today is New Hampshire State Senator Dan Feltes. Dan, I stopped you in the last segment about the opioid crisis, and I want to spend some time looking at that. And I really, I'm not an expert in this, and I don't know if anybody is. I mean, how do you be an expert in a crisis? I know there are a lot of really knowledgeable people focusing on this. And I want to sort of intertwine three ideas and tell me how far off I am or in the importance. But treating it as a public health, thinking about it as criminal justice, but sort of the corollary of the impact on child and protective services.
Right.
Those three things sort of jump out when I start thinking about this. How do we? It's so complex. How do we, as a state, even a small state, get our hands on these things?
Well, having sat through probably hundreds of hours of hearings on different pieces of legislation, trying to address this, having sat on the Joint Task Force, and worked with stakeholders and experts, hearing from them, and hearing from people affected. Heart-wrenching stories of parents who lost their kids because there wasn't treatment available, or because they, insurance coverage, for whatever reason, it just didn't work out for treatment that may be available, or in some cases sending their kids out of state to treatment and breaking up families and that sort of thing. It's something that has an economic impact, not just on that family. It has an economic impact on the businesses in our communities. And there are a number of different approaches. There's no magic bullet. We took a number of different bipartisan steps in the last legislature session. The single most effective way is to reauthorize our bipartisan Medicaid expansion, which provides health insurance to over 50,000 granted staters, but several thousand granted staters access it for substance use disorder treatment and recovery services. And that's really important. Other things that we have done and can continue to do is streamline access to insurance coverage to make sure that there's not arbitrary barriers or hurdles for folks who need timely treatment from their insurance carrier. Dealing with the bureaucracy of insurance carriers is not exactly a thing that is helpful in that kind of situation.
If you're in a crisis, dealing with your bureaucracy of any kind doesn't seem to make sense to me.
Exactly. Yep, you got it. So we broke down some of those barriers in the last session, John. We had good debates on those and got bipartisan legislation through. There's more we can do on that, though. There's more we can do to help out in terms of making sure our mental health system, often mental health, substance use disorders co-occurring, making sure that we bolster our mental health system. We have, in my view, a broken mental health system. We really need to step up to the plate at the state level and support it in ways that make sense.
How do we do that? I mean, that's a capacity sort of issue in some ways, is what I'm hearing. And how do we support that system that makes sense, as you say?
Well, first, we have to live up to our obligations. And there was a lawsuit. Disability Rights Center filed suit. State made an agreement. And, we just saw a report, an independent monitor report about where we're kind of falling short as a state.
And so, if we lost the suit once and we fall short, we're going to lose it again. I'm not a lawyer, but I should imagine, right, if you don't follow through on the remedy, you're going to be back in court.
Well, I'm not going to draw any legal conclusions, but I will say this, is that we ought to live up to our obligations. If we make an agreement, we ought to fund it. We ought to live up to our obligations. And that's not just good because you
legal
want to
advice. It's good public
policy. There's that phrase from Desmond Tutu, he said, at some point I want to stop picking people out of the river. I want to go upstream and figure out why they're falling in. And part of the reason why our most vulnerable in the state of New Hampshire are falling in is our mental health system is not working the way it could work. There's a lot of great people working in mental health, and our community mental health centers are doing a great job. But there is more that we can do. There's more support we can provide to those professionals to make sure that it works better.
What would be one thing that could happen in this next budget cycle that would add support for those people?
Well, we're gonna look at that in the context of HHS's budget, and HHS's budget has a number of other needs, and I think most important thing is to have the hearings, to bring people in, the stakeholders, the experts, and really look at it and scrutinize it to make sure that we're providing the kind of support needed to make sure that we live up to government's obligation to take care of our most vulnerable. And that transcends, John, mental health, but it also goes into other areas. I mean,
I'm going to have to stop you there.
Okay.
I'm going to have to stop you there. When we return, we're going to talk about these other areas, so please stay with us.